everybody. So it's Q&A time. The first question comes from Pamela, and she asks, after 36 years of living with lupus, I've developed Petechiae all over my body, but mostly on my legs. My platelets and other blood counts are good. I realize there are different levels of vasculitis. What I would like to know is there a natural way to treat it? In my reading and research, depending on one's condition, heavy-duty chemo drugs or Rituxan is used for treatment. Thank you. Well, I wish I can tell you there is a magical pill for vasculitis or Petechiae, but I believe you should do everything you can if you want to go holistic to support your body to decrease inflammation. Because at the end of the day, inflammation is what causes the itises. To add chemical or chemo drugs or Rituxan would be adding another layer to the toxicity to create unintended consequences that we don't really know about. So adjusting your lifestyle, the whole, you know about this, Pam, the detox protocol would be a great thing to heal your gut, decrease inflammation, all those collective things that you can do is going to help you overall. So focus on those efforts first. And you know where to find me if you have further questions. Second question comes from Larissa. Is there a possibility of having beta-2 tested twice in 12 weeks apart, glycoproteins elevated, a sign of lupus? Well, it's a great question. The antiphospholipid syndrome is a systemic autoimmune disorder that places patients at risk for thrombosis or blood clots. The condition consists of moderate to high titers of antiphospholipids, lupus anticoagulant, cardiopin antibodies, and anti-beta-2 glycoprotein antibodies. So it's not a matter of just the glycoprotein itself, but you're asking for antibodies to that. So such antibodies are often found in serology of lupus patients collectively as a whole. The beta-2 glycoprotein is considered to be the main autoantigen for anti-cardiolipin heterogeneous nature of APL, which is the, antiphospholipid syndrome or antibodies. Combined measurement of both cardiolipin and anti-beta-2 glycoprotein 1 antibodies may provide you with more insight about lupus, but in and of itself, by itself, I'm not sure how much it tells you. Even if those levels are high, you'd want your doctor to assess the full lupus-specific serology to rule in or rule out lupus, because you don't just look at that serology or that level to determine whether you have lupus or not. Okay, it's a peripheral consideration. So the third question comes from Tina, and she asks, hi Connie, in your experience, does the extreme fatigue ever go away? Do any of the medications treat the fatigue? I wish it did. But yes, the extreme fatigue does go away. However, there's no medication to treat fatigue, as the fatigue is the result of metabolic insufficiency from so much inflammation due to lupus activity typically. And when we've got so many antibodies against our own cells become busy and tired from fighting that war. So logically, a better way is to help your body be more resilient to make sure it can fight the battle and win, to have more energy. We've got different options, holistic options, should you want to try them. Our alkaline detox protocol is amazing for driving the detox pathways in your body, and giving you ample amounts of nutrients and energy back into the cells. We've got supplements that you can try, complete with probiotics and various multivitamin supplements, as well as various diets that are completely free on my website. The diet is anyway. You can go to my website at lupusrebel.com and sign up to your level of issues on my website, and I'll give you all the natural, holistic lifestyle interventions that you can implement today to start feeling better. So I do hope that this helped you. If you enjoyed this Q&A, you can find this Q&A feed on our private Facebook group called Lupus Rebel. You have to answer the questions, you guys, to be admitted. We don't want spammers. I'm not here to just waste your time or my time. I want really only those who are serious about getting well holistically with lupus to join me and ask me questions to help you achieve just that. You can find me also on Pinterest, Instagram, and of course, Facebook at Lupus Rebel, and lupusrebel.com is my website or our website, and then Dr. Connie Gian is where I post all the YouTube videos. So I hope to see you guys there. I post weekly, and I'll see you guys next week.